All right, top of the morning, top of the evening, top of the night, whatever time zone you are on, we are live. Hopefully, I'm not sounding like I'm in a tunnel tonight. With that being said, a moment of silence for all those who have lost their lives. Let's remember this. If we can look up, we can get up. If we can get up, we can go up. Let's get to this music. You see the title. Let's get started. Hopefully, everybody's been doing the best that they can in the situation that they are in. I'm going to get to a little bit of music and we're going to go right ahead and get into this. Watch out, but just a move on up. We move on up. Move on up. Mhm. All right. Now, with that being said, I want to start right here first. Let me go straight to um, some slides that I captured today from Dr. Tobin. And I have some from the other doctor, but I want to go right here. And he broke down function of the lungs and how we breathe. And I don't know if people ever have had to go through and learn how to speak again. I don't know if people have um, taken any real vocal classes to learn how to breathe and sing appropriately. But I understood what he was saying. It was just so plain. And so let me go back because we go to the lung function. He explained that um, Mr. Floyd lung function. So he spoke on that. He rebutted the unfounded study that's been out there because it's not sufficient enough. Uh, Something the defense uh, attempted to use. Or so any attempts to use this, it's been completely rebutted. Um, Again, back to the lung function. Proper way to breathe in, letting the air fall into your mouth, out of your mouth. He explained everything, the prone position, and just the entire breakdown of that, vocal cords, trachea, just everything. Um, what do I have on here next? Okay. I know I have more slides. So I just wanted to show a bit of slides, and I do have more slides. But now that I've done that, let me go right into Dr. Tobin. And so let's see something. Come on. All right, there it is. What we seen earlier, if you were watching, we saw the defense stumble. He stumbled in attempting to question the doctor, and the doctor made sure he brought clarity to any ambiguous or felonious claims, foolish claims, as well as, okay, there's the screen, as well as clarifying some things. So make sure this is right where I need it to be, and it should be. As well as the defense stumbling and not having his information updated that he got April the 6th. Yeah. So let's go. Hello, Mika. And hello, Bushes.
So let's talk about your opinions with respect to this case. Have you formed an opinion to a reasonable degree of medical certainty on the cause of Mr. Floyd's death?
Yes, I have.
Would you please tell the jury what that opinion or opinions are?
Yes, Mr. Floyd died from a low level of oxygen, and this caused damage to his brain that we see, and it also caused a PEA arrhythmia that caused his heart to stop.
Doctor, in this case, were you able to observe whether Mr. Floyd's breathing was impacted by the handcuffs and the placement on the street?
Yes, I was.
What did you observe, Dr. Tobin?
What I observed is particularly is in terms of the hands of the police and the handcuffs, particularly on the left side. So they were forcing his left wrist up into his chest, forcing it in tight against his chest, forcing it high up. And you have to keep in mind that the opposite side of this is the street. So he was being squashed between the two sides. And so this meant that he couldn't exert his pump handle because, I mean, the street totally blocked his pump handle. There was no way he could do any front to back movement. And again, the way they were pressing in on the back, there was absolutely no way that he could do any front to back movement. Then in addition, because of the knee that was rammed in against the left side of his chest, sometimes the knee was down on the arm or in against the chest. So this would have the same effect. So basically, on the left side of his lung, It was almost like a surgical pneumonectomy. It was almost to the effect as if a surgeon had gone in and removed the lung. Not quite, but along those lines. So there was virtually very little opportunity for him to be able to get any air to move into the left side of his chest. And so if you look here on the first slide, you see that Mr. Floyd's nose, his face, is directly face down on the street. It's not at any angle. In many of the calculations, I excluded the effect of his leg and his shoe because some of it was touching the ground, but here you can see none of it is touching the ground. So we're taking half his body weight plus the weight of his half the gear, and all of that is coming directly down on Mr. Floyd's neck.
So, Dr. Tobin, what do we see here in Exhibit 943?
What we're seeing is that half of his body weight plus half his gear weight is coming down. That's 91.5 pounds is coming down directly on Mr. Floyd's neck.
Okay, let's get to the next slide, because again, like I said, the defense attempted to cross-examine. You know, he did what he's getting paid to do, but the doctor was like, no. So in a cross-examination, one of the key takeaways for me is the doctor was basically telling the defense, you don't know what you're talking about, and in a very polite way. And no, this is not a hypothesis. This is factual. Science can be proven. Math is solvable and science is provable. The doctor just let him know, no, it's provable. And again, what's so significant about this doctor is this is his first time ever testifying in any case. And this is the doctor who introduced and helped to introduce sleep apnea facilities in the United States of America. So, and he wrote the books that everybody else studies. And, you know, quite naturally, he was going to go there, especially in terms of breathing. Not only that, ventilation, machine breathing, that's him. So, it was no street that the defense could go down to cross-examine this professional that would make Chevron look innocent, because he's guilty. But let me move on. I don't want to get to the next slide. So the jurors were paying attention, and, you know, he was like, feel trachea, feel side of the neck. They were, according to the media that's allowed to monitor the jurors, they were participating when he was saying, okay, because he was talking directly to the jurors, do this, do that. You know, you let the air fall into your mouth. And if, like I said, for people who've ever had any type of vocal training, you know, you let it fall in to fill up, you know, lungs expanding from them, just different things. But let him talk, because I need not attempt to come behind specialists such as this and pontificate.
One, 2, 3.
Respirator rate.
5, 6, 7, 8.
So that was roughly a 17-second clip?
Right.
And you counted 7 or 8 breaths.
Between 7 and 8, yeah.
And did you use this to calculate a rate of respiration?
Yes, because I mean, it's simple. Once you have 19 seconds and you count out the number of breaths you have here, and if it, say you count out 7 breaths, that will come out at a respiratory rate of 22.
Is that number, the respiratory rate of 22, significant to this case?
It's extremely significant.
Why is that?
Because one of the things in this case is the question of fentanyl. And if fentanyl is having an effect and is causing depression of the respiratory centers, the centers that control breathing, that's going to result in a decrease in the respiratory rate. And it's shown that with fentanyl, you expect a 40% reduction in the respiratory rate. So with fentanyl, his respiratory rate should be down at around 10. Instead of that, it's right in the middle of normal at 22.
So you didn't see a depressed rate of respiration or breathing rate in Mr. Floyd?
No, it's normal.
And so what does it tell you, bottom line, with respect to fentanyl as relates to Mr. Floyd?
Exactly. In terms of fentanyl, one of the major changes you see in fentanyl is a slowing of the respiratory rate. So, and again, we would be expecting a 40% reduction in the respiratory rate with fentanyl. The normal respiratory rate is 17 breaths per minute, plus or minus 5. So that would mean a normal respiratory rate of between 12 and 22. That's the normal range of respiratory rate. And so if it was with fentanyl, you'd be expecting a respiratory rate of 10. Instead of that, you count it here yourself. And you can see when you count it yourself that the respiratory rate is 22. So basically it tells you there isn't fentanyl on board. That is affecting his respiratory centers. It's not having an effect on his respiratory centers.
So Mr. Floyd's respiratory rate was normal at 22 just before he lost consciousness?
Correct.
So the jury may have heard some other information in the case about the fentanyl related to an elevated carbon dioxide level in Mr. Floyd's body in the emergency room. Was that significant to you?
Yes, that's very significant as well.
How so?
Because he's reported to have a PCO2, sorry, I take it back. He's reported to have a carbon dioxide level in the arterial blood in the emergency room of 89. That's a very high level of carbon dioxide. And so you have to take into account what are the factors that might have led to that. And there's particularly important factors in Mr. Floyd to explain why his carbon dioxide was found at 89 in the emergency room.
So, Doctor, would you first tell us what would normal have been for carbon dioxide levels?
The normal carbon dioxide level in you or me is 35 to 45 millimeters of mercury. That's the norm. You don't need the millimeters of mercury stuff, but they're the units that are given in the hospital chart.
So you said that there were significant factors in the case of Mr. Floyd. Would you help the jury understand what those were?
Yes, the important factors are that we know that he made his own last spontaneous effort to breathe at 20:25:16. After that, you can look at the videos and you see he makes no effort to breathe. He makes no breath. The last breath he took was at 20:25:16. Then we know after that he stayed on the street for another 3 minutes or so. Then he's placed into the ambulance, and we know that in the ambulance they attempted to put in an airway, an eye gel, and you can see that on the Officer Lane's body cam. You can see all of that happening, and then you can see the time at which they actually successfully inserted the airway and when they gave him the first breath. And that is a gap of 9 minutes and 50 seconds from when he last took a breath.
And why is that significant?
That's very significant because we can calculate what is the rate of increase in the carbon dioxide in somebody who doesn't breathe. If somebody doesn't take a breath, carbon dioxide increases at a predictable rate. And that rate is up to 4.9 millimeters of mercury per minute that it increases. And so he has not taken a breath for 9 minutes and 50 seconds. So you would expect, just on that basis, that his carbon dioxide level will go up by 49. So you add 49 to the normal values of 35 to 45, and then you add that and you're going to get a value of between 89 and above. And so it comes out virtually identical to the value that they found in the emergency room of 89.
So doctor, what's the punchline with respect to that? What does it tell us?
The significance of all of that is it's a second reason why you know fentanyl is not causing the depression of his respiration. What you're seeing is that the increase in his carbon dioxide that is found in the emergency room is solely explained by what you expect to happen in somebody who doesn't have any ventilation given to him for 9 minutes and 50 seconds. It's completely explained by that.
So when a person then is not breathing, then carbon dioxide would naturally continue to build up in the body.
Yes.
And that's what matches what was seen in the OR for Mr. Floyd.
Precisely.
Now, you said that there were other things that were significant that were related to the rate of respiration, and we talked about fentanyl.
Right.
Was there anything else?
Yes. The other things, there's two other things that are very important to the respiratory rate, because you saw it with your own eyes, exactly his respiratory rate. And the first thing is that if you have somebody who has underlying heart disease, and the heart disease is so severe that it's been said that it's causing shortness of breath, that it's causing you difficulty with breathing. If somebody has heart disease that's causing shortness of breath, virtually all of those patients are going to have very high respiratory rates. They're going to have respiratory rates of 35, 30, over 30, even over 40. When you have heart disease, that'll give you shortness of breath. Instead of that, we find that his respiratory rate is normal at 22. The second thing that's important about the respiratory rate of 22 is if you have somebody where the primary problem in the body is airway narrowing, where you have somebody where there is that the airways are being compressed, there's narrowing in the neck, or there's narrowing like in somebody in the chest, what the response, the physiological response to airway narrowing is a normal respiratory rate. And that is what he has. So it's but the respiratory rate that you see that's normal is the expected physiological response in somebody who has airway narrowing.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos,
stop George right there because
highlights and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news.
All right, you heard what the doctor said. Bring up another clip that I didn't have onto this because he's so thorough, detailed, and melodic. And again, the defense fumbled and stumbled today in attempting to question not only this doctor, but the doctor who was after this doctor. And so the medical examiner gave another cause of death for George Floyd. But these doctors today, especially this one, who's never testified in any case before, who is the specialist of the specialists. Like I said, when it comes to sleep apnea, when it comes to certain type of breathing machines, all that's him. When it comes to introducing sleeping centers to the United States of America, this is the go-to doctor. When you are looking at breathing literature and books, thick books that they read, they're reading his information. So the defense stumbled in trying to question, because the doctor made sure that he was clear very politely in many instances that he didn't know what he was talking about. He just didn't say it that way. But if you can comprehend, you can comprehend. You caught it, you caught it. Because it was very plain. As well as, the defense, the prosecutor asked the questions too, but they will be really careful. And, but again, all the nonsensical questions the defense team has been asking others, these doctors today were not the ones to play with and attempt to try to manipulate or work anything, because they definitely block clarity and make sure in all your getting, you got to understand it today. And that's the way it went down. So, we saw this one. Okay. All right. That is it. We already saw that one. I thought I had more. But